Thank you. Again, I'm Carla Holcomb. I'm one of the MIS Berry Fellows at Ohio State. And I have nothing to disclose. So we've talked about this earlier in the session, but over 7 million GERD diagnoses are made in the US annually. As we all know, first-line therapy is with medications like PPI and lifestyle modification. However, in those select patients that either fail this kind of treatment or don't want to be on long-term medications, laparoscopic Nissen fundoplication is an effective treatment. So there's actually been a lot of literature published in the psychology journals about the association between GERD symptoms and people with underlying psychosocial comorbidities. They've reported that patients with anxiety and depression tend to report more severe GERD symptoms. And anxiety disorders in themselves have been linked to a hyperalgesia effect of the pain that's produced by GERD symptoms. The aim of our study was to determine if patients with anxiety or depression would report worse outcomes following laparoscopic Nissen fundoplication. So this is a retrospective cohort study. We had a prospectively maintained database of patients who underwent laparoscopic Nissen fundoplication between the years of 2011 and 2017. This was at a single center. Our study variables included, we stratified the patients by if they had anxiety, which was defined as they had an active prescription for benzodiazepine. And then the other patients, if they had depression, which was defined by an active prescription for a serotonin modulating medication. Our outcomes of interest were GERD HRQL question scores. We looked at how patients reported their pre-op symptoms. Postoperatively, we called them for long-term follow-up and gave them these questionnaires. Additionally, we asked them the question if they were satisfied versus not satisfied after their surgery. And just so everyone is aware, with the GERD HRQL scoring system is a validated instrument. It ranges from the score 0 to 50. It's 10 questions asking about GERD symptoms and can be anywhere from 0 to 5 on how bad their symptoms are. So overall, we had 271 patients in the study. 103 of those patients were classified as having depression, 44 with anxiety. The median BMI was 30, Demeester score of 40, and the baseline preoperative HRQL score for the population was 30. Our long-term follow-up rate was 15 months, and we had this data on 53% of people that actually responded to the phone questionnaires. So for our depression cohort, we actually found that they were very similar across the board regarding their pre-op studies and their post-op reporting. So as you can see there, they had the same sort of Demeester score pre-op, baseline HRQL scores of 30. And then when we looked at these patients and their long-term follow-up and asked them the questions, their HRQL scores previously at 30, in both groups went down to 5. And there was no difference in whether or not they were using antacids or if they required any endoscopic dilation in the long-term follow-up. So next up, we looked at the subset of patients with anxiety compared to those without anxiety. And these patients actually looked quite different. So preoperatively, their Demeester scores tended to be higher, 43 versus 38. That number was not quite reached statistical significance. They did report worse GERD symptoms pre-op, so their baseline HRQL scores were higher than those without anxiety. And then when we looked at them long-term, they reported higher or worse GERD symptoms in their post-op follow-up. That was 7 versus 4, and that was statistically significant. However, they did vastly improve from pre-op to post-op, and there was no difference in if they were using anti-acid medications or if they required endoscopic dilation. And then lastly, when we asked these patients, were they satisfied or not satisfied after surgery, we did see that patients across the board, so no depression, patients with depression, or patients with no anxiety looked very similar, as in they had pretty high satisfaction rates, very low not satisfied rates. However, the patients who actually had anxiety looked vastly different from the rest of the population. In fact, 63% of them reported being not satisfied with surgery, even though they had similar post-op outcomes as far as their improvement in GERD symptoms on their HRQL scores. So some of the limitations of our study, I had a response rate of 53%, so I don't know what the rest of the population looked like that didn't answer the phone questionnaires. And then it's unknown if there is any anatomic reason for the higher HRQL scores, but I doubt that given that, you know, the overall HRQL score in the population postoperatively was pretty low at 5. And so in conclusion, patients taking antidepressants report similar subjective outcomes and high satisfaction rate after lap Nissen fundoplication. And although lap Nissen fundoplication does improve the GERD symptoms in patients taking anxiolytics, satisfaction is rarely achieved in long-term follow-up. So I think preoperative counseling is especially important regarding post-op expectations in these patients with anxiety. And thank you. I'd be happy to answer questions.